Welcome to the ADHD Women's Wellbeing Podcast. I'm Kate Moore-Youssef, and I'm a wellbeing and lifestyle coach, EFT practitioner, mum to 4 kids, and passionate about helping more women to understand and accept their amazing ADHD brains. After speaking to many women just like me, and probably you, I know there is a need for more health and lifestyle support for women newly diagnosed with ADHD. In these conversations, you'll learn from insightful guests, hear new findings, and discover powerful perspectives and lifestyle tools to enable you to live your most fulfilled, calm, and purposeful life wherever you are on your ADHD journey. Here's today's episode. Today I have Dr. Cara Davey here, and we're going to be talking about the intersection of trauma and ADHD. So I just wanted to give you that heads up from the very beginning of this conversation in case maybe you're not quite in the headspace for it. But Dr. Cara Davey is an expert in this area, and she is a clinical psychologist who is passionate about helping adults with ADHD. And she is also a trauma specialist with extensive perinatal training who really gets how ADHD present in both men and women, including all the hormones and the difficult life events, and how the times of transition impact on ADHD symptoms across the lifespan. And Dr. Cara has also got ADHD herself after the traumatic stillbirth of her middle child. And she also has 2 other children with ADHD traits as well. So she really understands and knows the impact of ADHD and on our lives personally as well. And she understands that most adults with ADHD have never been taught skills to thrive in a neurotypical world, and is passionate about sharing the tools she has learned personally and professionally to help other people benefit from them too. So Dr. Cara Davey, welcome to the podcast.
Thank you. Thanks so much for inviting me.
Yeah. So, I mean, obviously from the outset, this conversation, we're going to be delving into that intersection of trauma and ADHD and being able to unpick the 2 differences, but also how they marry together and the overlap between them. There's just so much there. But maybe we could just start with maybe sharing your personal discovery of ADHD and how that came about.
Yeah, of course. So I've been a psychologist for almost 15 years now, and was specialising more in kind of trauma. Experienced my own kind of difficult fertility journey, including stillbirth of my daughter, as you mentioned. And it was around that point of trying to become a parent, parenting, and all of the kind of fertility issues that it became obvious to me that I learned more about how ADHD presents in women, and the symptoms of my ADHD increased hugely to the point that I was like, what's going on here? And then, having read more about ADHD in women, look back and went, these have always been here, but they just ramped up incredibly. And I think as a trauma specialist, I was already doing a lot of trauma therapy with people. And so immediately after my stillbirth, when I had trauma therapy, was, emotionally okay, then started helping and supporting other people with infertility and grief. And, emotionally I was fine, but the forgetting my keys, losing bank card, just general ADHD type stuff was not shifting at all. And I was like, what is that about? And I guess it took me into the space of being really interested. As I learned about my own ADHD, I then kind of looked more into executive functioning. And so, now I kind of specialize in, okay, what can we process through trauma therapy, and how can we help and improve ADHD symptoms as a result of that? And what is more about scaffolding executive functioning, kind of ADHD type problems? And I think, so my own personal journey helped me to discover my ADHD, and just helped me to really, it was 4 years of trying to unpick, how do I help this bit of my ADHD? How do I help this bit? What do I do? Which I'm now really passionate about supporting and helping other people to do, because, trauma just exists so much.
Yeah,
People with
it really does. I'm just interested to know, did you ever see or spot or think you had ADHD sort of growing up, or I guess maybe after the birth of your first child? Like, did you notice, or was it kind of one of those things that a lot of us talk about, is that we could have lived with it? We kind of knew we were a bit scatty, or we were a bit disorganized, or prone to anxiety, or these little nuances. But often it does take these big life events. And unfortunately, very often it is the traumatic life events that almost ramp up. And I'm just interested to know if you'd had any suspicion there was ADHD there before.
Yes. I mean, there'd been a bit of an ongoing joke of being a bit ADHD without really ever reading the criteria to know what it was. And I feel a bit funny as a psychologist, I feel like I should have known. But essentially, I think when I trained a long time ago, it was still very much what was taught was the kind of naughty boys in class type stereotype of ADHD. So I'd kind of dismissed it as, yes, I did write lines for talking too much in class. Yes, my school reports did say Cara needs to think before she speaks. Like, there were obviously some signs there, but generally I did okay, and I went through the education system, so I didn't feel like I fit that. But my mum worked as a secretary in a GP surgery, and she was like, "Keep getting these letters through about people with ADHD." She's like, "This sounds very familiar." And there was definitely, I would make the mistakes that people might make occasionally a lot more frequently than other people were making them. And there was kind of, a bit of chaos would surround me, but I functioned okay until the trauma. Like, that was the point at which it, despite those quirks, I just accepted them as quirks. But yes, they were very much there, but I hadn't really recognized it in myself until I properly looked into it, and until the trauma made it to a point where I was like, I need support and help to function, kind of better than I am now, because I knew it was significantly different to pre the trauma.
Yeah, no, absolutely. And this conversation of trauma and ADHD, and it can be quite a sensitive and an emotive conversation because there's a school of thought, driven, I'd say, by Dr. Gabor Mate, who believes that ADHD is a result of trauma. And other people feel quite invalidated by that because they believe that their ADHD has always been there, and we see it, genetically. And his argument is that trauma can be genetic. My argument is, I think that people with ADHD are more likely to experience trauma. So there's this sort of cycle of like trauma, ADHD, and until we unpick it and we are able to help ourselves. And it can feel really hard to unpick. It can feel really hard, like, what is this? What's that? And I obviously am not a trauma expert, but I'd just be interested to know what your thoughts are on all of this and how you see this intersection. And I guess generationally as well, how we kind of just see trauma kind of being passed down alongside the ADHD.
Absolutely. I mean, I think there's a really complex kind of intersection between them, as you say. Like, I'm very familiar with Gabor Mate, and I think he started off saying the genetic part of ADHD was a kind of sensitivity, someone being slightly more sensitive in terms of, to their environment, or emotionally sensitive. And then there needed to be some difficult life events essentially to trigger that into ADHD, I think was his kind of view. But yeah, certainly some of the other stuff looks very invalidating in terms of, no, it's all trauma. I won't get into too much of a Gabor Mate debate essentially, but I mean, what I see again and again is, as you say, they coexist. And, you know, it's so common for people with ADHD to experience trauma because other people find their behavior more difficult. Whether you're more the hyperactive type kind of symptoms of ADHD, where people will kind of label you difficult or, kind of challenging, or people will want you to stop doing things and try to kind of suppress you. And you will get teachers finding you difficult, or, parents might find you difficult, or you get parents where one parent is kind of almost like good cop, bad cop. One parent's trying to be understanding and supportive. The others, no, we need to be stricter. So you end up with lots of interpersonal trauma. And I think for those who are more inattentive, even so, people will be like, why are you not listening? Like, why are you not paying attention? Or you're in your own little world. Or, so certainly other people notice those differences. And I think it does cause interpersonal trauma. And you can see more of a kind of, you're more likely to feel misunderstood, and that people don't understand you, don't get you. And so those kind of elements of trauma, I think, often exist. And then we've got, I mean, it might be helpful to explain the difference between small t and big T trauma. So essentially, if we're talking about trauma, you've got your big T traumas, which are the things that people think of when they think of kind of PTSD or trauma. So someone who's in a car accident, someone who has a traumatic birth, someone who goes into war, someone who's assaulted, those kind of things are our big T traumas, the things that are life threatening or kind of impact on our bodies. And people associate those with, these will give trauma symptoms or PTSD, and we will get treatment for those. But actually, there's also small T traumas, which are things like interpersonal conflict, divorce, retirement, having complaints made about you, things that affect your ability to cope and send you into kind of overwhelm, and are traumatic in terms of the, have an impact on you, and could still be really beneficial to have kind of trauma therapy for. And yet they aren't necessarily recognized by society as being so traumatic. And I think what you find with people with ADHD is they tend to have experienced a lot of those small T trauma growing up. And sometimes when people then present for an ADHD assessment or looking for treatment, they have automatically internalized, I'm difficult, there's something wrong with me, or, there's a problem with me, and they've experienced a lot of this trauma, but wouldn't even see it as trauma. But services might see it as trauma. And then, kind of there's this fear of, will I be labeled as experiencing trauma? And therefore the ADHD is yet again dismissed. And so, yeah, I think there's a really complex interaction. It's quite rare, in my view, to have done an ADHD assessment and at the end of it to come out and say this is trauma and no ADHD. Like, they normally exist together. It's very rare will I've assessed someone and come out at the end and gone, no, actually, I don't think this is ADHD, because, well, just so often they do coexist.
So, I mean, does trauma change your brain wiring?
Mm. Yeah,
Yeah.
absolutely. Yeah, absolutely it does. And I think that's why partly, we get this kind of intersection of symptoms that are the same between ADHD and trauma, that some people, and, if you go to see a clinician who's less understanding of ADHD and how it presents, they might be saying, well, these are all trauma symptoms. But actually, yeah, trauma affects how it affects our nervous system. It makes our nervous system more kind of sensitive. It makes us more hypervigilant and more aware of danger. It affects our cognition. So things like the executive functioning that you see in ADHD, actually, our cognition is changed by trauma. It can affect sleep because it affects our executive functioning. It can affect attention, forgetfulness. So it is really hard sometimes. It can affect impulse control because of, so there's a lot of symptoms that you will see down the middle of that overlap, which, as I say, if you've someone who's functioned quite well with ADHD and a practitioner doesn't know much about how that presents and masking, might then say, these are just trauma symptoms. This is the impact of trauma on the brain. And it's why you get, a bit of a debate out there sometimes about the kind of validity of ADHD. But yes, trauma does absolutely affect the brain, and it does affect how sensitive we are to emotions and how well we can regulate. But some of those things can be, through trauma therapy, can actually be kind of minimized back. So essentially what happens is the brain becomes really sensitive to danger, and the amygdala becomes more sensitive, and therefore you react quicker to anything that might be perceived danger. So threat, rejection, whatever that threat might be. And through trauma, you can kind of widen the window of how much we can tolerate before we're sent into that flight response. So yes, it does affect the brain, but we can also not reverse it completely, but we can certainly, through kind of processing trauma, we can reduce the impact of some of those things. So it's not a kind of forever impact, although it does depend on the severity of the trauma when it was experienced.
Okay. So I'm thinking of, like what you mentioned about the small t and the big T traumas. And
Mm.
if we've had ongoing trauma throughout our life, are these small t traumas, such as feeling rejected, ostracized, for so many of us, it feels very physical and it feels really hard to like contain. And so they were having to put a lid on it again and put a lid on it again, which then obviously creates this highly sensitized nervous system, this hypervigilance, this fear, constant fear. How, I think it's really important for people to have that validation that this does have an impact. These are traumatic moments through our lives, because like you say, no one, God forbid, would ever want to go through what you went through. Losing a loved one, losing a child, war, abuse, like anything like that. It just seems so, what we've gone through, say, and compared to that, we kind of go, absolutely not, that's not trauma. But would you say it's actually helpful to have that validated for us so we can actually understand what's going on in our bodies and our nervous systems?
Yeah, absolutely. And I think when we think of big T trauma, often other people validate how distressing and upsetting that is. If you have a car accident, you lose a child, any of those things, often other people will say, goodness, that's so difficult. I'm sorry you've experienced that. It's really normal for you to, obviously react to that, or, to have a bigger kind of emotional reaction to that. And yet, these small T traumas, in some ways, when someone comes for trauma therapy, it normally takes longer to support someone who's had ongoing invalidation and distress across their lifespan, and that's hugely impacted their self-esteem because they've assumed it's them, because it is so ongoing and constantly there. Like, actually, that's sometimes much harder kind of emotionally than a really difficult event, which, if you get the right support for at that time, it might be that actually you can be supported through that and then go back to feeling okay because you've always felt okay. And yet it has the same impact on us emotionally, in terms of trauma affects the brain in the same way, regardless of if it's big or small, but also just the process of trying to unpick and go through just to clarify, if you're doing trauma therapy for small t trauma, you don't have to process every small t you've ever experienced, because obviously for a lot of people, you'd be there for a very long time. And one of the things I like about kind of EMDR trauma therapy is that actually it's very effective quickly at being able to process what you need to process. But yes, I think it's hugely important to validate, first of all, no wonder this has had an impact on you. And actually, where you've been made to feel like you're the problem all of the time, actually, maybe these things happened because other people didn't understand, didn't know how to support you. You talked about intergenerational trauma. We know genetically it's much more likely if someone is neurodiverse that their parents are more likely to have been neurodiverse as well. And parenting as a neurodiverse person and parenting neurodiverse children, like there's a web there of that's quite difficult. It's quite challenging circumstances. And you might have been made to feel like it's all you and you're difficult, when actually that was a result of parents struggling with their own neurodivergence and how that kind of played out in the interplay. So I think it's really important to get that message of maybe this isn't just me, like maybe this isn't about me, maybe this is about the circumstance and what I've been through. And
Mhm.
that then adds into, you're more likely, if you've had an invalidating home environment, to perhaps then end up in a relationship where it's invalidating. You might also then go into a work situation where you accept being treated in a way that other people might not. So you then get it within the workplace, or so you might have this pattern of it always happening in your life, which is incredibly difficult. And you just assume again that that's all about you. So it's really important to be able to unpick, oh, maybe that's not what's going on here. And maybe that's not understanding. And maybe there are ways to change those relational patterns so that going forward from this point, things are different. And I have relationships in my life that feel different and aren't invalidating, and, kind of where I'm seeing.
Yeah, yeah. And I think also our parents' generation and the parents before that, they wouldn't have had the resources and the tools and the coping mechanisms and even understand and pick to have this language. I've said this so many times, is that, back in those days, it was literally they were taught a way of coping, a coping mechanism from their parents. And it's only really this generation where we're talking about these things, that we're having open conversations and using words like neurodiverse and trauma therapy and emotional well-being and somatic, healing and all of this. Like, people didn't have this 20 years ago. So we're in a very kind of, I hope, exciting place of healing, but also it's very challenging because we're able to look back and think, no wonder my parents couldn't cope, because they couldn't regulate themselves. And if they're neurodiverse themselves, how are they then going to look after neurodiverse children if they can't regulate their own emotions? And also, we only are just understanding addiction and addiction patterns. And first of all, seeing that we can see it genetically, we can understand why people become addicted, like what the emotional fallout is of that, all of this. So I think it's just sending ourselves so much compassion for everything that we've gone through without any of the tools and the help that we did, as children. And only now, and I know that so many women like us are getting these diagnoses like midlife, whether it's come from sort of perimenopause or, like you say, it's come from post-trauma. We see this after the pandemic, this explosion, because that was a global traumatic event for everybody while we were all dealing with our traumas within the house, losing loved ones, financially, working from home, homeschooling, not knowing what this outcome was going to be. Like, we've lived through this once in a lifetime situation that was catastrophic for many of us. And I think we're only just processing this now, 4 or 5 years later. Hi, I am just interrupting today's podcast because I have some things I want to update you on. And because you are here listening to the podcast, you deserve to be the first ones to know what is going on in this space. So if you haven't heard, we have live workshops happening between now and July. We have incredible topics to help you in your daily life, ranging from nervous system regulation to helping ourselves with RSD, to discovering our strengths and working to them, to hormones, to family dynamics. I'm really covering a big variety of different topics to help you in daily life. You can buy the All Access Pass, which gives you access to the past recordings and all the future ones. You get reminders and you get some discounts with that. We have the book that is out on pre-order now, the ADHD Women's Wellbeing Toolkit is available. Please pre-order it through the website and you will get some freebies, some free gifts, especially for this, plus discounts on all my resources on the website. And finally, I am in the middle of creating probably my most exciting product to date. It's a new membership. It's low cost, it's accessible. It's a membership that I would want to be part of. It's for you if you are just discovering your ADHD, or perhaps you've had a recent diagnosis and want a place to process it, a safe space to touch base every month, to hear from me, to offer you lots of advice and guidance in a really non-overwhelming way. This is going to be about quality over quantity. It's going to be about connection, support, community. It's going to have my vibe all over it. So if it's something that you are interested in and you want something really accessible, really hand-holding, kind, supportive, compassionate, all those things, I really hope that you will check this out. All you have to do is put your name down on the wait list. We are launching in September, but anyone who has their name down on the wait list gains access to the founding members price. That means that you will be locked into this founding members price. And from September, anyone that signs up afterwards, the price will go up. So I hope all of this information is of interest. Everything is on my website, ADHDwomenswellbeing.co.uk, and you'll get all the information there. I'm going to let you go and listen to the rest of today's episode. Here it is. What I'd like to ask you is a little bit about cPTSD and PTSD. I'm very interested in cPTSD and for people to understand what that might be, because I think there's a lot of us living with this undiagnosed and we don't even know what that is.
Yeah, so cPTSD is complex PTSD. It's essentially when there is more of a, as we were talking about, where people have experienced a lot more traumas. It's kind of multiple traumas that are built on top of each other. So you experience one difficult life event and then another and another and another. And essentially it has more and more of an impact on the nervous system, more and more on our kind of emotional well-being, our emotional ability to kind of regulate. And I think complex trauma was often, some of the mental health diagnoses out there are often, when we look back, there's now a much more of a questioning of, when people have been labeled as having, I don't know, say a personality disorder, or someone has been labeled as bipolar, or actually have they experienced multiple really difficult traumatic events in their life, and these are the result, the symptoms they're experiencing or the kind of distress we're seeing, are they the result of that kind of complex trauma? So PTSD is generally then as one event, or one big event, that kind of big T trauma, and your complex PTSD is when there's kind of multiple big events, or you've got that kind of ongoing distress as well as kind of more multiple events, and it has, as I say, a kind of a big impact on well-being. But again, both can be supported and helped through trauma therapy. It's just complex PTSD tends to take longer to work through, or might take kind of longer in therapy to get to a point where you're noticing a kind of difference on well-being. But yeah, both can be very much helped and supported by trauma therapy.
Yeah, and I'm interested to know, you mentioned EMDR before, and I think we're understanding a lot more that trauma can be processed. Potentially is more beneficial to process it through the body somatically. I know that with my EFT, I see how effective and efficient it is to be tapping and talking and validating, as opposed to sort of just sitting there and having, talk therapy. And I'm wondering what you're seeing, I guess, as clinical psychologist, that you're understanding. Do you think that somatic therapy is the way forward now for therapy, or do we need both?
I mean, I think it depends on the person's presentation and what they've experienced as to what would be most kind of supportive and helpful for them. I mean, we certainly know that trauma is held in the body, and that, the impact of trauma affects us physically as well as it affects us kind of emotionally, psychologically. So, it makes sense that some of the more somatic therapies, it makes sense that that is a way for people to work through some of that trauma. I know less about, I don't want to speak on something that I guess I'm not so kind of trained in. So I know less about what is and what isn't effective. I know at the moment the evidence base for kind of working through trauma is more sits in trauma focused CBT and EMDR as the two that are kind of more effective. And the reason for that is that they're processing the trauma in terms of what we know about memories, traumatic memories, is that because you're dealing with the trauma at the time, is it doesn't get processed by our kind of memory system in the same way that other memories do. And therefore, it's that kind of going back over the memory and being able to, as you say, to hear the distress in it, to look at actually what interpretation did I make and how do I feel about myself as a result of that. And actually, now when I look back at it, is that an accurate kind of representation of how I felt at the time? But then also physically moving it into the memory store where it should be to be kind of filed away properly. We know that all of those things together are really effective in being able to process trauma. But does it impact the body? Absolutely. And one of the things, the reason I go for EMDR therapy over other therapies is because it very naturally, the brain will go where it needs to in terms of trauma. It will take you from one trauma to another in terms of, right, this is what I need to process. And you don't have to. CBT for me feels much more manual. I'm trying to guess, or maybe this links to that, or but I might be wrong. EMDR naturally shows you where it needs to go, but we're also very much in touch with what's going on in your body now. What can you see? What are you experiencing? And so I am there with someone and holding them so they're not going through that trauma again alone as they're experiencing it. So there's very much kind of, I'm here with you, you're not alone. It's okay, it's not happening again. Like, so you're processing in the presence of someone, which is different to that kind of alone experience people have had. You're also moving the memory to a place in the brain where it's different and it's in the past. And people will say very quickly, sometimes within a session or two, wow, that just feels so different. Like where is the power or that emotion gone? But you also notice it's physically different. So I've had people who've come in the clinic literally kind of unable to walk with a stick or whatever. And as we've worked through the trauma that they've experienced, they've suddenly gone, oh, the chronic pain has gone in that arm and the pain's gone in that arm. And, I've had people who can walk from the train station 20-minute journeys, no longer got a stick. Like suddenly the trauma's physically left their body as a
Hmm.
result of processing it. So there is certainly an overlap between the impact of trauma emotionally and cognitively, but also on the body itself. So people experiencing, chronic pain, chronic fatigue, all of those physical symptoms, yes, very much it's bodily. I know less, as I say, about the somatic theories to be able to say how well they are at working that through, but I'm sure there is a good evidence base. I'm just less familiar on it. But yeah, what I like about EMDR is it does all of that. I feel like it's very much a being with, and it also processes the trauma in terms of moving the memory across, and it works with the body and the emotion. So it feels very much like it's a very holistic type of therapy in a different way to other talking therapies. And I think
Yeah.
it's so effective so quickly.
I've had some EMDR. I'm not sure if it was the right practitioner, if I'm honest. But what was interesting is that I went for one reason. And like you say, my brain took me somewhere else. I was like, right, I'm going to go in. I really want to sort, this, I want to be efficient and sort this issue out. But actually, it took me somewhere completely different, to somewhere that I think I had been suppressing. So we can never underestimate the power of getting curious and thinking, actually, maybe it is time. Maybe it is time I start unpacking a little bit. But on the flip side, as a trauma therapist, would you say that some people are terrified? Like they just think it's easier to suppress? If I just hold it down, I've been doing it for decades, to then have to talk about it or look at it again, it feels too much. It feels too overwhelming. I mean, what would you say to someone who is thinking, this is all very well, but I'm not going back there. That was too much for me back then. I don't want to address it again.
Yeah, and I think different people have different coping mechanisms. So I don't want to at all sound judgmental of different approaches. For some people, they box away trauma and say, I don't want to go near it. And they manage to function well enough and they're quite happy with that choice. And again, if we go back to thinking about older generations, often that's what was encouraged to do. And you might find people of the older generation who are just like, absolutely no way. And, we need to respect that if that is someone's kind of choice. At the same time, often what I end up seeing is people who have tried that and then suddenly something happens that triggers when something has been boxed away. Actually, you know, it's going to come back up, or it can come back up, and then people are in more crisis mode of, oh, I really have to deal with this now. I see it a lot, for example, with in the kind of perinatal side of the work that I do with people who are pregnant again and go, well, I thought I didn't need to process that last traumatic birth, or kind of my previous loss, and now suddenly I'm terrified and I need to look at it. Also, sometimes people come then, but the reality is doing something like EMDR, like looking at a trauma therapy, it is hard to do emotionally. Like, I won't lie, I had EMDR myself after my loss. Like, it's not an easy thing to do, to go back to the emotion. And at the same time, the shift that you can see if you, and you talked about the right practitioner. I think it is really important to get the right practitioner, especially if you're neurodiverse. Finding someone who
Yeah.
understands neurodiversity and knows how to adapt trauma therapy for people who are neurodiverse is really important. But if you go back, even within a few sessions, for a lot of people, they will say, "Oh my God, like I didn't realize how much of an impact this was having and how much I've been holding on to it." And a few sessions that have been really hard have then got me to a place where I feel completely different. And I've been doing trauma therapy for over 10 years with people. I've lost count of how many people I've supported with trauma therapy. And I don't think I can think of a single person who at the end is like, "Oh, I wish I hadn't done that." Like everybody at the end is like, "I can't believe what a difference it makes." So I think whilst it's completely understandable for people to say, "I don't want to go there," or "It's too difficult," or "What if I open this box? There's too many things that have been pushed in the box and it feels overwhelming." At the same time, if you're finding the right therapist, you don't necessarily have to process everything. And the difference that you might feel, might be huge. Some people say, "I just want to do this one trauma." And they're like, "That's so different. Actually, can I look at this while we're here?" Or the brain will take you to something else. And then they're like, "Oh, like actually that's completely changed." Some people, especially people with ADHD, might have got this kind of not being good enough, or there's something wrong with me, or, we know how it affects self-esteem. And yet we do some processing of traumatic events within that. And at the end, they're like, "This wasn't all about me. Actually, I was misunderstood," and it totally shifts what they thought was entrenched self-esteem issues that they'd have forever. And actually, sometimes you don't realize how much you're holding on to until you process it. So yes, it's scary to do, and I totally understand some people might feel like it's too big. And at the same time, the impact can be huge. And there's so many effective, there are things that are really effective for ADHD. I was going to say so many effective treatments. We're not treating it because it doesn't go away, because it's there forever. But obviously we manage, for some people they manage it with medication. For some people they have ADHD coaching and try to manage the impact or structure their kind of executive functioning difficulties. But I think sometimes people miss how effective processing the trauma can be in terms of creating a shift. And for some people in really small amount of sessions, like I don't think it's known about enough, really, just how much of an impact it can be to process that trauma on reducing some of those comorbid, the symptoms that are
Yeah.
inherent to both ADHD and trauma.
Yeah, and you can never be too old. Again, I hear this from people maybe in their 60s and 70s, that they just think, "No, I'm too old now. I've lived long enough without having to deal with it." But like you say, even if you could just live your last few decades of your life feeling lighter, with more inner peace and more understanding and acceptance, that's huge. And I get frustrated. I've got certain family members who are sort of, in their 70s, and they're just almost poo-poo the thought of going through any form of, therapy, or anything, or just talking about what they've gone through, because they just don't think it's worthwhile. They think, "Well, I've lived this for this long," which is a shame. It's a shame, because I think through other people healing, people, then there's a ripple effect in the family. So if someone, who is the matriarch or the patriarch of the family, they go through healing and understanding, it can trickle down to the rest of the family as well. So yeah, I'm just putting it out there to anyone that's listening and they think they're too old. I don't think, you can. I wanted to ask you, what would somebody have to be more aware of with someone with ADHD who wants to go through trauma therapy?
I think there's a few things. So first of all, you want someone who's got a good enough understanding of ADHD that they're going to validate and be able to work out what is trauma versus what is ADHD. So you want that kind of ability to validate. But in terms of how EMDR is different, I mean, people with ADHD often process much faster. Uh, they are more likely to be distracted. What I've noticed pre-COVID, the kind of go-to for EMDR was that you would have your hand kind of go in front of someone's face to make their eyes move from left to right while they're thinking about the memory. And the idea is you're taxing the working memory, but you're also processing it. It imitates kind of REM sleep. When we dream, when we process at night, what we're trying to do is get the eyes to move that memory over to where it should be stored. But what you would find is pre-COVID, a lot of people I've worked with are like, "But I can't follow, and oh, that's making me feel dizzy, or I can't follow that and think it's a memory," or like it was really hard to concentrate on all of those different things. When we went into COVID, we realized you can do it online by tapping, and actually you can have your eyes closed and your eyes still move from left to right. It still imitates the brain left to right. And suddenly, by that shift for me with people with ADHD, suddenly nobody's saying, oh, I can't do it anymore, I can't get into the memory, I'm too distracted, or like, so there was a massive shift in people being able to actually get into the memory. And I think sometimes people are still using methods of trying to kind of imitate the movement, the bilateral stimulation we call it, that aren't very ADHD friendly at all, and that people can't get into it properly. So I think there's that. We process often at different speeds, and I think we need to be aware of, if someone is processing at a really fast speed, do they need as long a session, or actually they're processing a lot and then you need to pause more to give a bit of space afterwards to talk about it, to regulate, to kind of work that through. There are, certain, it depends on the person as to what the adaptation is, because it will depend on their presentation of ADHD. But I think when someone is familiar with ADHD and how it presents, they can see when they're processing, okay, when this isn't going as we would expect it to, or when it's feeling more emotionally overwhelming, what's getting in the way, and what is it I need to do to adapt to that. Whereas I think if someone doesn't have an understanding of neurodiversity, it's really hard to pick up what someone might need and to attune to that and adapt it. So, yeah, it's not always the same adaptions, I would say, but certainly I do find it's different. And I have a team of psychologists, and within there, there's a couple who prefer not to work with people with neurodiversity because they're like, oh, I can't keep up with this person, or so I think that's also really helpful for me to know who not to refer to, in terms of if someone is neurodiverse, they might be brilliant at other things. But I think it's really important, if you're going to seek out trauma therapy and you're not feeling like I've got a good connection with the person in front of me, or I don't feel they get me, or they don't seem very confident that they can adapt it to what I need if I'm struggling a bit with the processing, or I need it done a little bit differently. I think it's really important to consider that when finding the right therapist, because that's when the shift happens, is when it's attuned right with you. And so important for people with ADHD, as we say, because that attunement often hasn't happened in earlier
Yeah.
years. Getting it right in therapy is really, really important.
I think that's really validating, for me especially, to hear that, because I just was like, I don't feel the connection. But
Mhm.
also, I struggle with visualizing. So if someone says, right, visualize yourself, da da da, da, I really struggle to get back into that place. A lot of my childhood, like my memories have sort of just been wiped. I have like very few childhood memories. So, and I didn't experience one big trauma, but from understanding and having some counseling and therapy and stuff, there were lots of mini traumas, but I couldn't visualize. And so I felt I was over obsessing in my head, like, why can't you visualize? Why can't you see? You can't go back to that memory. So I think my ADHD and my overthinking just kind of almost took over. So I would love to try again with someone who really understands ADHD trauma therapy. And yeah, so I will be speaking to you about this.
Yeah, absolutely. I think it's so, so important. And I think you raised a really important point there about rumination. And I supervise a lot of other psychologists who are starting out in kind of EMDR therapy. That's one of the things I say, is from the very beginning, be aware of, if someone is in their head, I can't do this, I'm not doing it right, or I can't visualize. As soon as somebody gets into that place where they're anxious or ruminating about whether it's going right or wrong, it's going to interfere with the process. So at that point, it's really important to be like, okay, right, this has been difficult. What can we do to make it easier for you? How can we support you with that? Like, and getting people to a place of confidence. Very often, as soon as I see it, I'm like, it's really normal. Don't worry. You might not be in the memory yet. That's okay. Let's go back. What did you notice? Or, just really helping someone to feel like, I'm not doing it wrong. I'm doing okay. I will get into the memory, like that kind of confidence in the process, but also I'll help you to adapt this and we will get there together, I think is really important. Because yeah, as soon as someone is in their head, it gets in the way. And I think it's something I see a lot with more kind of newly trained people in EMDR, is that they then don't know what to do. Like the anxiety increases between the pair of them, where somebody seeking it feels they're doing it wrong, then the other person's like, oh, I'm not a good enough therapist, or and you get that kind of dynamic where they're not helping each other. So I think confidence in being able to see exactly what it is that is the barrier and adapt it, is really, really important. And yeah, rumination and kind of anxiety and worry is a big one, especially starting out in EMDR, until people have got experience and can trust the process.
Okay. And would you say, does it work just as well online? Was it better in face to face? Like, what would you say?
So pre-pandemic, I was doing it all face to face, and I literally, as we went into the pandemic, I was really worried about what am I going to do? My job is pretty much all trauma therapy, and I can't do it online. So I don't know how I'm going to do this. And I was very skeptical about the results of it. I thought you need to be in the room with someone. Actually, now, because of I've got quite niche specialisms in terms of more perinatal infertility and loss and that ADHD side, people tend to come to me for reputation or specialisms, and therefore I hardly see anybody locally anymore, and therefore I'm not in the room with them. But I genuinely haven't noticed any differences at all in effectiveness. And if not, I would say it's more effective now doing it remotely than in the room. And I think part of that is, as I said earlier, because I'm able to get people into the memory without worrying about this. Am I doing it right or wrong? I can't follow. Or, actually you're able to properly get people in because with their eyes closed and being able to kind of tap and me be alongside them online, actually that seems to work much, much better. So yeah, I have noticed it's probably more getting better results now, and I guess probably over time as well, more and more experience. But yeah, I genuinely don't think it's a problem doing it remotely. The only exception to that is for people where there's a high level of what we call dissociation. So if people cope with their trauma by essentially leaving the body slightly or kind of cutting off from emotions, and that's to an extent where they're less present and they might need someone in the room to kind of help them to ground and come back round when they're dissociated, that's when I would work with someone more in the room. So, for example, if someone's kind of what we say with EMDR is you want someone to have like one foot in the past and one in the present. So you should be aware of the event that you're processing, but you should also be really kind of present and in the room here. And if you've got someone who gets into the trauma so much that they're no longer aware they're in the room, then often we help people with that. So we might be like, right, let's throw a ball to each other. Like, let's do some grounding exercises in the room physically with someone to help them with that. And just a safety aspect that if someone is, kind of with dissociation, sometimes people can look almost like they're falling asleep. Or so if someone has got much more severe trauma and they dissociate as a result, that was a kind of safety mechanism for them when they were younger, then we would recommend being in the room is probably safer and more containing for them to be able to know that somebody is right there physically with them and can help them with that grounding. So yeah, in those cases, I would say in the room. Otherwise, online works perfectly well.
Yeah. I mean, I find, and I don't know if this is just my sort of hypothesis, but I find with my clients who are all neurodivergent that we all just quite like being online because we're in our own space. We've got all our comforts. We've not got the anxiety of like parking, traveling, being late. We've got a cup of tea. We've got like, we're in our own environment doing our own thing, and also sort of the eye contact, it can feel it's not as intense doing it online. So I think with all my coaching clients, everyone's sort of more comfortable where they are, and then it's done an hour and then you go off and do your own thing. So I know it's all preference, but I think doing a lot of remote work, there's a lot of benefits to it as well. I know a lot of people will probably say, right, how can I work with you? Where can you direct people to?
Yeah, so I have two separate kind of websites, I suppose. So one is more kind of looking at ADHD type support, and one is more the infertility and loss. Both of them have kind of different free resources, but essentially the ADHD stuff is more under the name of Dr. Davey Coaching, and that's ADHD coaching, ADHD assessments, and ADHD kind of therapy. And then the infertility and loss and kind of perinatal work is more under Cara, clinical psychologist in Sussex. And there are other people on the team as well. And when I select psychologists in my team, I'm very, very careful to select people of this is their area of expertise, so that if referrals come through and it's not me who would be able to see people because of availability, or I feel I'm not the right fit, and I'm very much like, who in the team is exactly feels like the right person for you, what you're saying. So yeah, if you've got questions or you're unsure, feel free to contact through. And we do ADHD coaching kind of under access to work as part of that
Brilliant.
as well.
Fantastic. Well, thank you so much for sharing all your expertise and your insights. Honestly, it's so, I think this will be very validating for people, for them to understand, and also maybe something that they've needed a little nudge along the way to maybe go and have some trauma therapy and process that, and hopefully begin that healing journey. So, Dr. Cara, Davey, thank you so much for being here today.
No, thank you so much for inviting me on.
If today's episode has been helpful for you and you're looking for even further support, my brand new book, the ADHD Women's Wellbeing Toolkit, is now available to order from anywhere you get your books from. I really hope this book is going to be the ultimate resource for anyone who loves this podcast and wants a deeper dive into all these kinds of conversations. If you head to my website, ADHDwomenswellbeing.co.uk, you'll find all the information on the book there, which is going to be out on the 17th of July. Thank you so much.